So after the 15 minutes, so without any disturbance, only apply the catheter, fixation of the intravenous catheter, then throw this intravenous catheter. So diazepams can be administrations at the dose rate of the 0.5 mg per kg body weight intravenously. So after reach at the desired strength of the sedation and start the next step of the anesthesia to induce the short acting induction anesthesia through intravenous and perform the endotracheal intubations. So 5 minutes after the intravenous administration of the diazepam, induction of the anesthesia can be achieved by the intravenous administration of the 1% propofol up to the till the effect. And similarly, you can use the 2.5% thiopentone up to the till the effect as an induction agent in the dog. So nowadays, etomidatin is also used as an induction agent. Generally, this drug is used in the human cardiac patients and hemostatic unstable patient. So after the intravenous administration of the induction agent, and check the following reflexes like the jaw tones, eyeball positions and pedal reflex, which indicate the characteristic of the general anesthesia. So jaw tone indicates the muscle relaxations, eyeball positions, corner reflex and palpebral reflex indicate the depth of the anesthesia, and the pedal reflex indicate the pain status of the animal. After the complete abolize all the reflexes, then start the endotracheal intubations. So what is the endotracheal intubations? So endotracheal intubations is a passes of the tubes through the mouth into the trachea to maintain the airway patencies. So these are the very simple meaning of the endotracheal intubations. So after desired depth of the anesthesia, animal shift in the sternal or lateral recumbency with extended head and neck for endotracheal intubations. So shifting of the animals either sternal or lateral recumbency, it depends upon the choice of the clinicians and skill developed by the clinicians. So both the recumbencies generally prefer either sternal recumbency or lateral recumbency. It totally depend upon the choice of the clinicians and skill of the clinicians. So after the shifting of the animals, either sternal or lateral recumbencies, then the retainer should fully extended the upper and lower jaw by using the cotton stings and pulling of the tongues towards the downward directions for the better visualization of the laryngeal regions. So does not push the neck of the animals in ventral direction, which obscure the laryngeal anatomies. So when you press in the ventral direction, means the chances of the disturb the anatomy of the larynx, you cannot visualize properly. So now endotracheal intubations is carried out after with the suitable size of the endotracheal tubes under the guidance of the laryngoscope or by the blind techniques. So some persons perform the blind techniques. So this skill is developed by such persons, so blindly to perform the endotracheal intubations without using the laryngoscopes. So following the successful endotracheal intubation, then you correct the placement of the endotracheal tubes can be confirmed. How to confirm this endotracheal tubes? Suppose the endotracheal tubes is entering inside the trachea, so show the mild coughing and passing of the expired air through these tubes. So these are the good indicators. The tube is inside the trachea. So animals show the mild cough in its initial stage. When you enter this tube inside the trachea, if the tube is inside, it means enter inside the trachea, so animals show the mild coughing and passes of the expired air through these tubes. That is very clearly visible. And finally ensure that tube enter the trachea and not into the esophagus. So this anatomy is helpful for the position of the trachea and position of the esophagus. So these are the cross positions. After the successfully the introduction of the endotracheal tubes, means the following successful endotracheal intubations. So inflame the cuff using the room air at the proper pressures. So optimum approximate pressure of the cuff is 30 mm per cm square. So over inflame of the cuff can result in the necrosis and the means sloughing of the tracheal inner the lining. After the successfully the introduction, so finally the secure the ET tubes in the place with the piece of the cotton string. Your waist IV set tied around the tubes, and behind the animal head you are on the top of the muzzle. So attach the endotracheal tube with the 5 mm adapter of the breathing suction with oxygen cylinder your left for the inhale the room air. So now enter into the step 3. So step 3 is the administration of the propofol as a maintenance agent.